Welcome back to PT Time with Tim. I'm Dr. Tim, a licensed physical therapist, and I'm here to provide you with the best physical therapy exercises and stretches to treat and prevent common injuries. Low back sprains occur when the low back muscles or ligaments are overstretched or overused. In my 20s, when I was serving in the U.S. Army Infantry, low back strains were the bane of my existence. So I'm here today to teach you the best tips to recover faster from low back strains. Okay, so the first step after a low back strain or a muscle pull, say you were bending over and you were lifting something up and you felt that muscle kind of all of a sudden cramp down, you felt a shot of pain in the muscle. The first thing you do is rest. You just got to stop whatever you're doing. You definitely don't want to continue to aggravate it. That is not going to make it better. So first thing, rest. The second thing is start using ice on the muscle. The micro tearing that occurs in the muscle belly is going to cause some inflammation. That's going to cause the pain. So start using an ice pack on your back for 10, 15, 20 minutes. You know, you can do it a couple times a day, but that's that initial inflammatory phase. Then after a few days of using ice, transition to heat because that muscle is going to tighten up. The whole muscle is going to tighten up because of the injury to it. So we want to get that muscle to relax. So transition from ice to heat. The next thing I want you to do is either grab a tennis ball, so this is kind of the cheaper option, or you can use what's called a massage block. So you can find these online. They are absolutely my favorite. It's made of a high density rubber. It's kind of this pyramidal shape that you can see with a rounded top and a flat bottom. So these things are wonderful. They don't roll away from you and they've just got kind of a soft firmness to them. And so we're going to use these to reduce the tightness in the muscle, the strained muscle. Because remember I said that strained muscle is going to tighten up really tight and that's going to limit your motion. So we need to loosen that up. And so I will lie on my back and we're going to use the massage block and I'm going to place it on the muscle belly, the muscle that's injured, but what I'm not going to do is I'm not going to go right to where that sharp stabbing pain is because we do not want to make that any worse. We don't want to aggravate that. So think of a bullseye. If the center of the bullseye is where you get that sharp stabbing pain, do not start there. You start on the outside of the bullseye where it's still tight, it's still tender, but it's much more tolerable. Like if it's like a hurt so good kind of feeling. And so you just roll in that area, so you can kind of take your knees side to side if you like, or you can just simply relax on that area. Spend a couple minutes there until it feels like that tightness and tenderness has decreased to some extent, and then you can kind of move that around because you really want to blanket that whole muscle belly to help promote that relaxation of it. Our next exercise happens to be my wife's favorite exercise, is supine lumbar rocking. And so for this exercise, you put your feet and knees together. Your knees are bent, obviously, lying on your back, arms down to your sides, and then keeping both shoulders down against the floor or your bed, you will rock your knees to one side until you feel a gentle stretch on the opposite side. You'll pause there 3 to 5 seconds, and then you're going to rock to the other side. And then you'll feel a stretch on the opposite side, holding 3 to 5 seconds. And so initially, after a low back strain, you're not going to have much range of motion, right? Because those muscles have tightened up, they're injured, they're angry. So you might even start real small with this one, which is totally fine. And you're just going to kind of work into it, and you'll go back and forth slowly. And what you'll notice is that your range of motion will slowly improve as you do it. So I usually recommend doing this at least twice a day, if not 3 times a day, morning, afternoon, and night. And doing it about 30 times if you're counting it 1, 2, 3, 4, to each side. So I'd say about 30 repetitions, 3 times a day. Our next exercise is supine dual knees to chest. So for this exercise, you're going to lie on your back. You'll reach down and grab around both knees. Now, if you can't reach around your knees, you can certainly reach under the knees. That's totally fine. That's a fine modification. But for me, I'm going to grab over top. Have your feet together and your knees shoulder width apart. You're gonna keep your legs relaxed, keep your legs completely relaxed on this one. That's important. So the arms are gonna do all the work. I will pull my knees in towards my chest, keeping them separated until I feel a slight stretch or pain in the low back muscles, because with that low back strain, those muscles are gonna be tight and angry. So we just wanna stop at the onset of pain or stretch, hold 3 to 5 seconds, and then relax. And we'll repeat that about 10 times. And as you continue with this exercise, you should notice that you're able to go a little bit further and a little bit further before that onset of pain. So that'll be showing that those muscles are relaxing the more that you do it. All right, so our next exercise is called a posterior pelvic tilt. Now, posterior means kind of backwards, so we're tilting our pelvis backwards. All right, so in order to do this one, you're gonna lie on your back with your knees bent. You can place your hands on your pelvis. Take your belly button and draw your belly button in towards your spine. So you're pulling your belly button in towards your spine, kind of bracing almost, right? Like I was gonna do a crunch, but I'm not. I'm bracing here, pulling the belly button in. At the same time I pull my belly button in, I'm feeling my low back, where there normally is that space back here, I'm feeling it flatten into the table or into the floor. So I always tell people, I always tell my patients, I'm like, picture a strawberry. If I had a strawberry back here in the small of my back in that arch area, so if I had a strawberry there and I pulled my belly button in and I'm flattening that back down, I am squishing the strawberry. So picture that in your mind. You're gonna squish the strawberry, bracing up here, continuing to breathe, so make sure you're breathing. But if you watch with my hands on my pelvis, I'm gonna pull that belly button in, tilting the pelvis back, holding for 5 seconds, and then relaxing. Pulling belly button in, flattening the low back, holding 5 seconds, squishing that strawberry. And we'll do that for 3 sets of 10. Our next stretch is a side-lying lumbar rotation stretch. So you'll lie on your side, you're gonna hook your foot behind, your top foot behind your knee, take your bottom hand or your bottom shoulder hand to the back of the knee to hold it down, so that kind of gives you that marker where it's kind of touching the floor. The top hand is going to reach up towards the sky, and then you'll gently relax and allow gravity to take that arm towards the floor. As you breathe out and you're relaxing, you're going to feel a stretch here in that low back with this rotation. So if you just relax with it, breathe out, and let gravity take it. Now again though, with a low back strain, you can stop at the onset of pain or stretch, hold that for 30 seconds, and then come back to about here, because that's complete relaxation, you don't feel any stretch, and then repeat that about 3 times, so 3 sets, 30 seconds, and each time you're just trying to sink into it a little bit further to improve that rotation range of motion, and make sure you do that both sides. Our next exercise is a prone press up. So you'll lie on your belly with your forearms underneath you, and you'll start all the way down against the table or the floor. You'll press with your hands and your forearms with your chest rising up, stopping at the onset of pain or stretch, holding 3 to 5 seconds, and then lowering yourself back down. And then gradually, as you repeat that, you're just trying to go up a little bit further each time. Do not use your back muscles. So I'm not lifting my chest with my back muscles. I'm using my arms to press my chest up. And that way those strained back muscles are not being used in this exercise. They're just simply being kind of moved with the motion. And you'll do that for 10 repetitions. Thanks for stopping by PT Time with Tim. You'll definitely want to go check out my back pain stretching video next, as you continue to advance on your pathway to living a pain-free, active, and adventurous lifestyle.